Welcome to the pharmaphorum podcast. This is web editor Nicole Raleigh, and today I have with me Florian Schnappauf, VP Enterprise Commercial Strategy Europe at Veeva Systems. Welcome, Florian.
Hi, Nicole. Thanks for having me.
Well, it's a pleasure to speak with you again. Now, listeners, today Florian and I will be discussing the future of AI in the life sciences and the role of data in commercial success. But to kick things off, Florian, for those listeners who perhaps haven't listened to you on this podcast before, perhaps you could share a little bit about your journey to today, the passions that drove you to your work with Veeva.
Absolutely. My pleasure. So for those who don't know me, I've been working around the life science industry for almost 20 years. And what drew me in initially was the fact that the products that the industry produces actually help people. So that was quite appealing and still is today. I spent many years in consulting roles, saw very different parts, or all the different parts of the value chain of life science industry, the pharmaceutical industry. And what emerged as, I guess, my theme of my work was how can I accelerate the work that the industry is doing, being it in commercial. So I supported launch situations, work with medical affairs on how to kind of position their role and make them the third pillar beyond R&D and commercial. But then also did some work in clinical and how to accelerate the clinical processes and bring medicines to patients faster. So technology started to play a more and more important role in my work over the years. I'm very, very well aware it's not the only role. There's many puzzle pieces that need to come together, but it's a big role. And that's also what led me to come and join Veeva 3.5 years ago, because Veeva offers quite a significant lever in using technology to further the goals of the life science industry. And that's why I really enjoy working at Veeva and the things we do. And I also feel we're only getting started on this journey because we're going to talk about AI today, Nicole. So AI is going to accelerate this progress ever further. I'm very excited about AI and what it can do for the life science industry moving forward.
Absolutely. As you say, when it comes to artificial intelligence, the tables are turning now, and there is a shift from considering it a hype to understanding that AI actually is a real necessity. And 2025 is that year specifically where it's becoming a turning point, where we're beginning to see practical embedded AI at the very beginning of scale. So, Florian, I was just wondering if you could share some more thoughts on this and explain for listeners perhaps where this real value in AI is being seen.
Yes. So we all use AI in various shapes and forms, be it in our personal lives or in private life. So we have a glimpse into what AI can do for us as a person, right? So now, if I look at applications in the industry, as you say, there has been a lot of hype in the last couple of years in particular, and a lot of companies investing into AI, but not reaping the benefits, I would say, yet. Right. So a lot of hype, but not the results have been behind the expectations, I would say, at scale. Now, what we see now changing is, and 25 is the year for that, as you say, Nicole, is AI getting embedded in everyday workflows, also in the life science industry. So it's not that separate thing anymore that sits outside of systems, that sits outside, and you have to use it kind of in addition to what you're doing. You're going to be using AI as part of your daily workflows, as part of your daily work. And with that, you're going to get much more and much quicker the benefits that AI is actually promising. So we see that embedding of practical high value AI happening as of now, as of this year, 2025. And that will help in kind of getting the value out of AI systems and AI tools much quicker.
Thank you, Florian. So if we focus on the notion of daily work and shift the discussion to commercial model evolution next, focusing on field teams, there's a complexity there, not just in terms of reps, but territory managers, account managers, the medical team, and other specialists, and a broad range of specialists working together at that. So when it comes to engagement, or more specifically, precision engagement with HCPs, thinking about that daily workflow, how can AI help there?
So AI can help in a lot of places here. But before I get there, I think it's important that we briefly talk about the enablers so AI can actually help you there. Before you can actually reap the benefits of an AI tool in the more complex world of life sciences, you need a couple of enablers in place. One of them is you're going to have clean data. So that's an important one. The second one is you were mentioning the complex field teams or the complex teams that need to bring medicines to the market and ultimately to the patients, to the doctors, and then to the patients. That necessitates an interconnectivity between all of these different people. So you need connected workflows. You need to be able to look at single customer records to understand what do those customers really need, those doctors, right? How are they accessible? What are their preferences? So you need to have that clarity in mind. And then you need to be able to connect with your colleagues in your pharma company so you can actually use that knowledge and kind of engage the doctors. So this is very, very important enablers. We're going to speak about data, I think, in a minute, that enable AI tools to actually give you benefits. And once that is in place, then you can start using AI, for example, to analyze your customers more deeply with all the information that you provided through the single customer record, all interactions being visible also to the AI, because that's the benefit, right? Everything we could theoretically see as humans, the AI also sees. And LLM models, generative AI models, are particularly good in crunching and understanding a lot of data, which we sometimes may not be able to do in every single situation, right? So this is the promise that AI then gives you. AI can help you analyze these vast amounts of data in very short time and suggest the right actions through the right channels. So it can help pre-engagement planning. It can help you also during conversations with doctors. We, for example, see a trend towards voice and voice-controlled interactions where an AI might actually be listening into a conversation and in a compliant way, then bring that into the system. So you can use all of these insights. So I think there's, in summary, two things that AI will be able to do for you. The first one is it will help you become more productive and more efficient in your work by significantly accelerating your call planning and your admin around that. But it will also be able to give you deeper and richer insights over time. The more we start using AI tools, the more we will also learn and get richer insights, for example, from more in-depth conversations that are transposed then into our systems. And that, again, will give you better tools to engage with the customers.
Thank you, Florian. So I want to come back to the compliance angle in a minute, but as you say, let's channel down into the data, so to speak. So as you've been saying, there's data and then there's good quality data. And it's widely known that life sciences still struggles with siloed and incomplete data. So perhaps you could share more with listeners about how AI can help with providing clean, complete and connected, this important word today, interconnectivity, connected data in this overall precision personalization strategy. And also speak to how real-time tracking can assist. As you say, we see things as humans and the AI sees things as humans see it. And that data is very much what we're seeing in real time.
Yes. So let me start with the data itself, right? Data is very important, and data can be generated by pharma companies through interactions with doctors. A lot of companies also buy external data sets, and those need to be brought together, right? I think the first thing I want to note is that these data sets need to be able to work together somehow. What's happening today is that there's a lot of effort being put in. Some customers say, some of our Veeva customers say between 60 to 80% of their data engineers' time actually goes into cleaning data sets. So there's only 20 to 40% of time left for any insights generation, right? So that ratio isn't right. That means that data sets, be they internal or external to the companies out there, they need to be able to adhere to a certain taxonomy so you can work with them more seamlessly. That's something that we've been starting at Veeva Systems a couple of years ago to introduce the common data architecture. So you have a standard taxonomy that's an open standard. We publish it. Everybody can use it if they want to, right? So, but I think that's important enabler if we talk about data. Data needs to be easier to work with in general, because that also allows AI tools to work easier with the data. So that's the first one. The second observation is, once we start using more and more AI tools, we'll be able to gather more insights, as I was just mentioning before. That also means we need to make sure that those insights that are captured can be captured in a hopefully structured way. So AIs in the future can again work with that data, right? And that means, I'm coming back to your initial question around the year 25 becoming the year where AI tools come into the daily day-to-day workflows. Embedding an AI into a deep application, such, for example, a CRM system that gives you all the capabilities that the industry needs in one place, allows the AI to leverage that infrastructure of the existing system to log in data, to work with that data in a structured way, and ultimately make it usable also for future insight generation. I think that's also important. So you need the clean data and connected data, as you were saying, but you also need deep applications that the AI can interact with. So you get that power of structure into the data and of insights generation. So I think these 2 points are very, very important. And then to your last part of the question, that real-time element. Right? AIs are very, very good in quickly analyzing all that data. So we need to make sure that the AI actually gets the data it needs, and it gets that data in real time or near to real time, depending on the application, right? So I think another important factor is the piping between all of those different things. So the pipes that we push the data through, we call it the direct data API. At Veeva, like a super lightning fast API that makes data to AI tools available in very, very quick time. And I think that's important. And that, again, to conclude, Nicole, allows then the users to understand preferences of doctors, of their customers, where they're speaking, maybe at ASCO, what paper they're presenting in close to real time, right? And that allows you to much better interact and engage with that particular person if you were not been aware with that. And the real-time angle becomes ever more important because a lot of doctors also out there use social media and they post out there. So you want to know what they're doing, so you can have the best possible interaction with them.
Thank you, Florian. So if we latch onto this word, if you will, of speaking, I want to come back to your mention of compliance earlier, not going into, whether our phones are listening to us or anything while we're having a conversation, but rather more specifically how compliance is addressed when it comes to these innovations we've been discussing today.
First of all, it's important. Everything we do needs to be compliant, right? We work in this beloved industry, UI, and many listeners out there. And compliance is very, very important, and it's there for a reason. So they need to go hand in hand. Compliance on the one hand side, but also using AI tools in the future shouldn't be kind of two extremes. They should go hand in hand, and they need to come together, right? So that's important. The second thought is, how do we do that? We shouldn't come into a situation where we fear, or are we still compliant? Is this AI tool still compliant? What are we doing? So how do we do that best, in my eyes, is by putting in compliance already at the design stage and connecting, as I was saying before, the AI tools to the deep applications I was mentioning. Let me give you an example. The applications that Veeva is developing have all compliance baked into the core of the design. Now, by adding AI tools on top of these applications, we're leveraging the compliance by design, right? That means that all AI tools that will be used through our applications have that compliance by design baked in, and we can be certain that they are compliant as well. So I think this is, for me, the way to go, because we're not developing something separate, I was saying in the beginning, but we're actually bringing together AI tools with existing compliance by design applications. And that way we ensure that we're staying compliant and that our customers stay compliant and that they can do the important work they're doing.
Thank you. So compliance from design, or baked into the core of the design statement, which I actually quite like the tone of, but also this notion of the structure, the importance of the structure. You've been mentioning future terms a lot during this conversation today, and the importance and power of the structure from the very beginning clearly will have an impact later on. So all things discussed and in place, what does the future look like for life sciences if AI is correctly implemented and that implementation scaled?
So I don't have a crystal ball as much as I would like to, but I think we see some themes emerging, and I think they will only keep accelerating. Now, the first one we've been starting to mention, and that we're starting to see now that AI becomes available in a practical way, right? Embedded in workflows. We see that efficiency and productivity gain that AI is promising us become more and more evident. So that means by the acceleration of adoption of AI tools that is starting to come to bear, we will see more and more productivity gains and efficiency gains by the people who are using them. And we're specifically looking, for example, at commercial. I think we can expect efficiency gains somewhere between 20 to 50%, not more in the future, right? So this is very, very significant numbers. And again, I don't have a crystal ball, but I just want to put these numbers out here to say we're looking at significant efficiency gains and productivity gains. And this is not inconsequential. That's the first. And that will lead to a whole array of new possibilities, right? You will know very well, Nicole, that the industry is launching so many new drugs. But obviously, the organizations who are launching those drugs cannot grow at the same speed that the number of medicines is increasing. So that efficiency gain and productivity gain, again, can be used to bring more of these life-saving medicines that are coming to market actually to the patient. So I think that's a good thing. We're not talking, in my head, we're not talking mass layoffs here, but we're actually talking unleashing even more potential of the industries through these type of productivity gains. The second element that we will see quickly come up is the quality of commercialization will improve. Why will that be the case? Because we will have a much better understanding of what the customers of the life science industry, of the pharmaceutical industry out there need, the information needs they have, the channels they want to be using, the way they want to interact, the things we've been discussing in the past, so that every interaction can actually start building on the last interaction. And we don't start from scratch, but we are moving up the ladder in terms of the quality of interaction and engagement with the customers out there. And that will allow companies to significantly better engage with their customers, but then also draw more insights from these interactions that can be leveraged again to improve their products, to improve how they commercialize, to improve the quality of the interaction. So it's not only a quantitative game here, but it's also a qualitative game where we think commercialization can significantly benefit from AI tools.
So quality, productivity, efficiency, bringing these treatments to patients faster, all that considered and unleashing the potential of the industry. Any closing thoughts for listeners today, Florian?
Well, AI, I was stating in the beginning, is an extremely powerful technology. And I think in a few years' time, when we will speak again, Nicole, I hope it doesn't take that long, but in a few years' time, we will look back into 2025 and say, this was only the beginning, and look where we are now, and look where we will be going. And I'm very much looking forward to that, and to be a small part of that process that we're going through, or that revolution almost that we're going through in the next couple of years.
Thank you, Florian. It's been a pleasure.
Thank you for having me, Nicole.
And that concludes another episode of the pharmaphorum podcast. You can find more information about this episode, including a download link and information about previous installments at pharmaphorum.com/podcasts. The pharmaphorum podcast is also available on Apple Podcasts, Spotify, Overcast, Pocket Casts, Podbean, and pretty much wherever else you download your other podcasts from. Just search for pharmaphorum and follow and hit subscribe. Of course, don't forget to visit our website itself, where you can sign up for daily and weekly news and analysis bulletins. And do follow us on Blue Sky and LinkedIn at pharmaphorum. That's all for now. Thank you for listening.